The following program could change your life as it has for so many others. It's all about an amazing new way to finally solve the problems many of us have with our teeth. If you've had years of tooth problems, if you've been ashamed by your smile, if you've spent thousands of dollars to no avail, if you've suffered from pain and frustration with dentist after dentist, then the next few minutes may just bring you the solution to a lifelong problem.
Teeth. They're pretty amazing. They're meant to last us a lifetime, so it's no wonder tooth enamel is the hardest substance in our bodies. Even ancient humankind knew the importance of their teeth. Anthropologists have found floss and toothpick grooves in the teeth of prehistoric humans. Makes you think, how can something that can last even hundreds of thousands of years go so wrong for some of us so quickly? Maybe that's why you're watching this film right now. Despite everything you've tried, you're simply not happy with your teeth. You've spent a lot of time, a lot of money, and a lot of discomfort trying to make them healthy, but it's been a losing battle. You've probably even considered, if you haven't already, pulling what you have out and living with dentures. And if you have, of course, you've been told that there's no way back to teeth that feel and function naturally. Well, that may have been true before, but not anymore, thanks to a revolutionary dental implant technology. The technology was invented at the nationally renowned Elmwood Dental Restoration and Implant Center. Introducing Hi-Bridge. This just may be the answer you've been searching for years.
When I was 14 years old, I had a bunch of busted up teeth. They were sort of decaying because I was breaking them all the time, and my dad sent me to the dentist, and the state was going to pay for my teeth, so the dentist did whatever he wanted to do, and he pulled every one of my teeth on the top and all but 8 on the bottom. I guess that was the easiest way out for him.
Stories like this, not unusual. So many people are trapped in an endless cycle of root canals, crowns, bridge work, hours and hours of sitting in dental chairs, treating the same teeth over and over for years.
I found myself lowering my head, and sometimes during conversations I'd cover my mouth with my hand, and I was very self-conscious about it.
Frustrations were I was getting nickel and dime to death. I was going here, going there, spending 1,000 here, 1,000 there, not getting any results, and just getting it. But the thing that got me was I was getting frustrated, and it changed my personality. My wife would say, "You're not the same guy," you know.
After he had it done, he just, I would say within a matter of a few days, he got his confidence back, and he just changed back to the way he was. And that's what you see today.
Acting like a nut.
Yes.
Joe, like many others, had dentures with the typical slipping and sliding, the difficulty with certain foods, and that artificial feeling in your mouth all the time.
I've been having problems on and off for years with loose caps, and I had problems with a root canal, and I knew I needed to have some work done, and I knew I better do it sooner than later.
We had one dentist in town whose philosophy, I believe, was drill 'em and fill 'em. And without proper dental care along with the cavities and the amalgam, things just started to fall out of place after a while because there wasn't enough tooth left to hold the amalgam. So I developed gaps in my smile and gaps in the back, and I had teeth extracted and started wearing partials and had crowns. Spent untold amounts of money restoring teeth that were beyond restoration.
I had a history of soft teeth, and I was going back every 6 months or so and having one tooth repaired at a time, and it got rather costly for me. So I thought perhaps I should have everything done at once, and I needed to go to somebody that I could trust and count on.
We've helped many people with the Hi-Bridge technology. We've restored their full dental function and given them something that looks, feels, and works like your natural teeth, a feeling that our patients truly missed.
I've wore top dentures without question every day. I've tried partials 2 or 3 times. I've had 2 or 3 different dentists make different partials for me in the bottom, and I could never adjust to them to use them.
And I was told quite a few years ago now, maybe when the implants first started coming about, that because of the way my bite was, that they wouldn't do an implant on me because I would put too much stress on the implant. And So that's why I went to dentures, and the cost too. It was going to cost me an awful lot of money even back then.
The question is, how did we help remove these people's frustrations and even fears? How have we made what you might think is impossible come true?
I've been working very closely with the inventors of Highbridge. I've trained with Dr. Frank Lamar during my prosthetics training, and we have continued through the years working towards having a prosthesis such as Highbridge. And since he has developed it, we have worked together to maintain and even continue to upgrade the Highbridge prosthesis together.
The name Highbridge comes from two words, hybrid and bridge. It's like a bridge, but it becomes a permanent part of you.
The Highbridge allows the prosthesis to be placed in the area where the teeth were, and the implants are placed in the position where the teeth were, thereby preserving the bone over time and preserving the muscle attachments and preventing the look of premature aging, which we see with complete dentures. With a Highbridge, the dentist needs to really understand how to put a mouth back together. As a prosthodontist trained and in practice for 17 years, I have really honed my skills as far as rehabilitation.
Every Highbridge patient has been amazed at their results. And the most important thing we've discovered is Highbridge does far, far more than promise a great smile. It seems that every dental office uses the word smile as a benefit. No, we're talking about a major improvement in people's lives.
It was difficult to smile, to talk, to eat.
With Highbridge, you can absolutely bite into a steak, an apple, anything that you would desire within reason, of course, but compared to a denture where patients just can't bite into an apple, they don't have the security that the denture isn't going to tip, rock, or fall out, this won't happen with the Highbridge.
Restoring to them the ability to chew and speak and feel confident. And in doing so, allowing them to try things in their lives they never would have without Highbridge.
If you have multiple missing teeth or broken down teeth, or wearing dentures or partial dentures, then you're definitely a candidate for Highbridge.
Of course, everyone has a lot of questions about Highbridge. It's an important decision. When most people see how easy the whole process can be, they want the Highbridge technology sooner than later.
When he put them in my mouth and he gave me a mirror to look, it was great. I mean, I could secretly smile, and it was like the beginning of a new life for me.
It's a great feeling to be not self-conscious of opening your mouth.
We can give you a better idea exactly how long it will take you when you come in for your Highbridge consultation. Then, of course, there's this question. What about pain?
The hardest part for me, everybody said, oh, was the pain. There was no pain. The hardest part for me was sitting still in the chair for 2.5 hours.
Highbridge technology oftentimes doesn't cause any discomfort at all because of the ability to use a flapless approach. What that means is that rather than opening up the tissue and accessing the bone to place the implants can be placed in just a small opening, the size of the implant. This will give you a much better result, faster healing, very, very little, if any, discomfort.
It didn't take that long, and there's not a lot of, there might be some discomfort, but there really isn't a lot of pain, so no, it really wasn't difficult.
It's almost a painless, effortless procedure.
Compared to complete dentures, there's a significant advantage to a Highbridge because the Highbridge chewing efficiency is very much like that of natural teeth. People with dentures have a chewing efficiency which has been shown to be only 20% that of natural teeth. Therefore, the people who have a Highbridge will be much more confident, and they'll be able to smile and eat in public and do things with much more confidence.
The next question most people have is about cost.
If crown and bridge work were going to be done to rehabilitate a full mouth, especially using implants, the cost of placing implants and restorations on all of the teeth would be exorbitant. But Highbridge allows us to use half the number of implants and still restore the same number of teeth at a much lower cost.
An investment. That's exactly what Highbridge is, an investment in yourself. All of our lives, we've known the value of putting our money away and investing for our future years. Investing in such a basic need as our oral health for a lifetime pays off better than any stock or bond you'll ever own. That's right, for a lifetime, because that's how long your Highbridge should last.
The success rate of the Highbridge prosthesis is 99.9% success. So this is much better than what we see with conventional crown and bridge work.
The installation of my new teeth is just wonderful. They're prettier than the ones the good Lord gave me, and they will last a lot longer than I will, I'm sure.
What I've seen with the Highbridge is that when the treatment is complete, the patients feel like oftentimes they've gotten their life back. They weren't able to function in society the way they once did with the confidence that they once had, and now it's all returned because of Highbridge.
I mean, that's the first thing that people see when they meet you, and they feel your handshake, and they look at your teeth, and they look at you.
I would highly recommend it. There is no other place.
I went in for an initial examination, and I liked the way they made me feel there. Very relaxed. The doctors were very approachable.